Hi, my name is Dr. Warrick Bishop, and welcome to my podcast and videocast station. Look, recently I've been privileged to have a number of very interesting medical people on my podcast station, and today is no exception. I'm joined all the way from Beverly Hills, Los Angeles, by Dr. Khalsa, who's founder, CEO of the Transformational Healing Universe. And welcome. How are you, Dr. Hahari?
Excellent. Thank you for having me.
Look, absolute pleasure. And as we've talked about before, I'm super keen to try and give people some sense of the broader picture of where healthcare can be. You're a holistic practitioner, and I'd love you to share some of your own sort of practice perspectives with the people listening so that they can have an idea of perhaps a different form of the way medicine can be delivered. So what's a holistic practitioner, Dr. Hahari?
Well, I mean, I've called myself a holistic chiropractor for 36 years. My background is in Kundalini yoga, meditation. Also, I've been an avid athlete my whole life, skier, mountain biking, hiking, so I'm a very active person, but I've always been obsessed with healing and in the sense of, getting to the root cause of most disease. So holistic, in my view, means we're getting to the cause of healing on the physical, the biochemical, and the energetic, or we could say psyche or mind. So those three levels of the human. And I use a system I was telling you earlier called Ciderscan, which is a German designed piece of engineering. But it's interesting because the inventor lives half the year in Australia. So
Yeah.
so it's called OzyMed. That's the name of his company. But anyway, I use that system to test the energy of the body. So as you know, as a cardiologist, you're doing EKGs on the heart and you're really measuring the electrical system. And actually, the entire body is connected to that system. And this biofeedback system was developed to measure all of the different systems of the body through measuring the energy of the body. So I would say it kind of goes into the realm of subtle energy healing, which isn't generally accepted by most Western medicine. In fact, they kind of shun it and they poo-poo it and say it's not relevant or it's not real, right? But I can tell you this, I've been using the system for over a decade. I've probably scanned well over 10,000 patients with it. And the accuracy as far as like picking up what is the underlying issue with that person is in the high 90s, as far as that person, let's say, knows they have a certain condition or injury or an illness that they had in their past. This system will pick that particular thing up in like 90% of the cases.
So if I can jump in, a couple of things about the Ciderscan approach that you use. Is that something that people can only access if they're going to a practitioner that has specific equipment?
Yeah, and again, it is in Australia. So that's the beautiful thing about I'm sure there's actually many practitioners in Australia because the inventor, like I said, he lives in Australia 6 months out of the year. So,
Okay.
yeah.
And I think the audience listening will have had the benefit of some podcasts that we've done in recent time on pulsed electromagnetic field therapy. And although you've quite reasonably mentioned that some of these concepts around energy, magnetism, and so forth are not broadly embraced by Western medicine, the irony is, in fact, some of these technologies, particularly things like pulsed electromagnetic field therapy, have been thoroughly researched with double-blind randomized controlled trials, and they're actually well-recognized papers supporting their value. So I think we need to move from a description of alternate medicine to a medicine that's under-recognized and undervalued.
100%. I mean, what I've seen, again, I've been working with Pulse PMF, high-powered, there's a differentiation between low-powered systems and high-powered systems. I've worked with both, but I much prefer the high-powered systems just because the results and the efficacy are much higher with the higher voltage systems. I've been working with that system now for, I think, over 6 years. And, one of the things I recently learned, I'm always learning new things about the stuff that I work with, but like one simple thing people can take away from this podcast is, whatever is going on with you, it could be anywhere from a broken bone to like say a bad back, or let's say you've got a lung infection, or even a heart condition. We've seen improvements on all of those things. And in general, you're going to heal about 5 times faster on a regular PEMF regimen.
Well, look, I can resonate with that. I can support that. Up until I'm a conventional Western medicine cardiologist. I sit on all the boards and committees. I write and contribute to some of the position papers that tell other doctors what to do in the space of cardiology. And I came across pulsed electromagnetic field therapy in the last year or two. I knew nothing about it, but the research has been compelling and really validates exactly what you're saying, Dr. Harhari. If you go to the Cochrane Review Library, which is considered a very high level of evidence in medicine, it's a library of data that you can only get into that library if it's been reviewed and considered appropriate research. It clearly shows impressive outcomes with pulsed electromagnetic field therapy. And when I read that this technology could halve fracture healing time, I nearly ended up sitting on my backside. I was blown away. So
I've regularly seen that with this technology.
I'm yet to have a personal experience doing it because it's not in my wheelhouse of therapy, but it's completely changed my perspective to be open to these sort of interventions. It's amazing, actually.
Yeah. Well, there was also, some other research recent, and I'll send you the webinar. It's from German orthopedic doctors. They did a double-blind study with really high pulse magnetics. We're talking pulse magnetics that are almost at the level of an MRI as far as the intensity of the field. And what they showed in that study is that it cut, like, for example, like the population base they were studying were knee replacement patients who were on a list for knee replacements. 50% of the people who got the therapy, it's called EMTT, extracorporeal magnetic transduction. 50% of the patients who received that therapy were able to cancel the surgery.
Wow.
Yeah, for knee replacement.
For those listening, this sort of stuff is completely amazing for me, Doctor. I would love you to send me the papers and the links. If you've got the paper, I would love that as well. But we're going to move past PEMF because I know my listeners have had the chance to hear a fair bit about it because I've covered it a fair bit in the last couple of months. But what I'd like to talk about is some of the other things that you do. And as we were talking before we started recording, you mentioned hyperbaric therapy and red light therapy. Tell me a bit about hyperbaric therapy first. How do you work that into your therapeutic regime and offerings?
Well, hyperbarics, again, it's similar to pulse PMF, that it's been researched for decades. There's thousands of research papers now written on hyperbaric. I would say the biggest takeaway that I got from studying the literature is that hyperbaric turns on over 8,000 genes that are responsible for healing and anti-inflammation in the body. And the biggest problem with most chronic disease is inflammation. So we're targeting at the deepest level the cause of most chronic disease with hyperbaric. And in addition to that, there's also a stem cell regeneration component, where what they've shown is that even 1 week doing a daily regime in hyperbaric, it will triple your circulating stem cells. So now
Wow.
your body has 3 times the power to heal whatever is going on with it.
Wow.
And yeah, it's quite extraordinary. Yeah.
So for me, because I'm ignorant in this space, and for those listening who may or may not know much about hyperbaric therapy, how is this administered? How often would you need to be doing these sessions? We talk about laying in a compression chamber, a high pressure chamber for hours a day. How does it sort of look? How does
We
that?
normally do an hour. That's our normal regime time. And typically we tell people 3 to 5 times a week. It just depends on their schedule. But the research is very clear on hyperbaric. Every say week that you're in a chamber, if you're doing say 5 sessions in a week, you're going to triple your stem cells. If you do that 4 times in a month, so you're doing 20 dives, you're 8xing your stem cells, 8
Wow.
times. Yeah, that's the research. And then if you go for a longer period, if you go for 3 months doing 60 dives, you regrow your telomeres by 25%, which is, that's what actually got me to get serious about hyperbarics. When I saw that research from the Israelis, that was it. I was like, I need to look at this.
Well,
Yeah.
as you're talking, I'm thinking I need to buy one for home.
Yeah.
Again, if you could send me the research on that,
Yeah.
Dr. Hari, that would be Harari, that would be just fantastic.
Yeah.
The so the other thing that we spoke about was red light therapy. Now
Yeah. Red light.
I
That's
know,
huge. Red light, we use a system called trifecta, which is I think it's one of the most powerful, like as far as wattage, total wattage of red light. It's actually 4 wavelengths. It's 2 wavelengths of red, 2 wavelengths of near infrared. Combined, it's saturating to the utmost your mitochondria, which is responsible for producing your energy in the body, the ATP. So basically, when you're in the red light at that level of intensity, you're maximizing the production of ATP. And because of the near infrared range, you're also maximizing your production of melatonin, which we know is, most people think of it as the sleep hormone, but melatonin is also a very powerful antioxidant. It's one of the most powerful, and your body makes it when it's exposed to the right wavelengths of light.
when we're looking at this sort of red light therapy, you've already made that distinction between red light and infrared or near infrared.
Yeah.
And one's obviously visible light and one's not visible light. Um, do they have slightly different impacts on the body?
Yes. Each wavelength is targeting a different part of the cell. In the red spectrum, mostly what's happening there is collagen production and fat loss, or the release of fat out of the cell. Whereas the near infrared range is targeting more but you're also getting ATP with the red as well. But in the near infrared, you're getting the melatonin and ATP. And also the near infrared is much deeper penetrating, so you're getting more into the organs, where the red, it only penetrates more near the surface, so it's helping with skin rejuvenation.
So ideally we want a hyperbaric oxygen chamber with near and red light therapy within it. Is that right? And a pulsed electromagnetic field.
Yeah, those 3 things are going to optimize total cellular respiration, mitochondrial function, mitochondrial biogenesis. I don't know if you know who Jack Cruz is. Are you familiar with that? He's a neurosurgeon. I would highly recommend you get him on your show, by the way.
Yeah,
He calls himself, he's a mitochondriac. He's all about the mitochondria. And those 3 therapies are really I would say, the gold standard for mitochondrial health.
Well, look, I'm not expert in this space, Dr. Hahari, but I
Yeah.
love talking about it. One of the angles that I've got some knowledge, I guess, not a great deal of experience, but a little bit of knowledge about when it comes to mitochondria is the supplementation that we can use. And I read a book some time ago by a cardiologist who is an integrative cardiologist um, with a very holistic approach. And his name was Dr. Stephen Sinatra as
Oh
in
yeah, I know who that is. Yeah.
yeah.
Yeah. Yeah.
And his book really talked about the supplements that would probably support these interventions. And for those
Mhm.
listening, those supplements, and I think I've touched on them before on this podcast station, those supplements are coenzyme Q10. Coenzyme Q10, ubiquinone, because it's ubiquitous, is a facilitator in the electron transfer chain. In fact, it's one of the components of the electron transfer chain within the mitochondria. He recommends D-ribose so that you can make more ADP, that structural component. He recommends L-carnitine, and L-carnitine helps with the transfer of fatty acids into the mitochondria. And lastly, he recommends magnesium because magnesium is associated with nearly 400 different pathways within the body. So it's an
Yeah.
important cofactor. And he
Yeah.
calls those his awesome foursome or the four pillars. And what I'm hearing is that that sort of support, that supplemental support with the external energy
Yeah,
manipulations
yeah.
you're
When
talking about.
you start stack, we call that stacking. When you start to stack these different
Yeah,
things, you
yeah.
start to see like healing miracles happening. I had one lady, it was very fascinating. She came in um, with this lung condition. She hadn't been able to take a deep breath. She had gurgling lungs for 50 years. 50 years. And
Wow.
just literally from 1 week doing red light, hyperbaric, and pulse, her lungs cleared up. I was like, wow.
Yeah, isn't that? And I think what that speaks to, and I've got to be aware of the time, so I don't want to rush, but I think what that speaks to is if we can get our bodies working optimally, our bodies will do much of what we need. And I
Yeah.
guess that's what you're working towards.
Yeah, I mean, it's maximizing cellular health. Everything about health is about your cell
Yeah,
at the end of the day. And that
yeah,
means as much nutrients in, toxins out, as much voltage in, that's PMF, as much ATP, that's red light, and as much oxygen, hyperbaric. When you combine those, it's like a garden. You're feeding your cells, which are like your plants in your garden, and they
yeah.
get healthy.
Look, I'm super excited about the chance to have spoken with you, Dr.
Yeah.
Hahari. 25% extension of my telomeres is something that I'm pretty excited about chasing up as
Yeah.
well. And I
Yeah.
super look forward to being in touch and getting some of that research from you.
Yeah.
Um, but in the interest of time, we're going to have to wind up.
Okay.
Are there any main keys or messages you'd like just to get out to the listeners before we wrap up?
Well, probably the biggest one, to be honest with you, is something you can do for free. It doesn't require any equipment whatsoever, and you have a ton of it in Australia, and that's called the sun.
Yeah, beautiful.
Getting full direct sun every day on all parts of your body, you're getting all the different frequencies of the sun. The UV, the near infrared, the far infrared, the red, all of that stuff synergizes your hormones and your mitochondria. That's probably the number one thing that people can do that's free and
Yeah.
easy.
And in fact, do it barefooted in
Yeah, and grounded.
on
So
the
now you're
ground,
getting the
grounded. Yeah,
magnetic energy of the earth. So,
absolutely.
all these things we have in the clinic are great supplemental tools to help heal like chronic conditions. But when you're talking about total wellness, the sun and the earth are really the keys to the whole thing.
That's beautiful. Great advice. Look, for those listening here in Australia, reach out if you've got any queries or questions. But if you're listening to this in California, if you're in the LA area, if you're somewhere near Beverly Hills, go and check out Dr. Hahari and go and check out the Transformational Healing Universe. I think it could do nothing but good for you. Dr. Hahari, thank you so much for speaking with me today. It's been an absolute pleasure.
Awesome. I really loved it. Thank you.
Thank
Thanks for
you.
having me.
For those listening, super appreciate you tuning in. I do really respect that our time is so precious these days. So if you've given a few minutes to me, I hope I've respected that. I hope you found something informative and valuable for your own best health journey. Till next time, I wish you the very best in health and hope you live as well as possible for as long as possible. Take care and bye for now.